Okay. All right. Hi, guys. It is Friday night, April the 3rd, 2020. We are in COVID-19 shutdown. And so we thought we would take this opportunity and maybe share some knowledge. And so tonight I have Miss Melanie Weller, and it looks like some of you might know her. Melanie is a physical therapist, a medical visionary, and a storyteller of the human body. She's the world's leading expert in the spiritual and stress-related underpinnings of our physical bodies. Melanie uses her vagus nerve decompression and story prescription processes to enhance health, performance, and creativities in her clients. Melanie is based out of Louisiana, right? New Orleans?
Yeah, yes,
Yep.
New Orleans.
So without any ado, Melanie, take it away. Tell us about
you,
you a little
Dr.
bit
Penny.
more.
Yeah, so I've been a physical therapist for about 24 years, and I was an athletic trainer before that. So I've been treating people at different capacities for almost 30 years. And I collected a lot of credentials along the way. I'm board certified in orthopedics. I'm a certified athletic trainer. I have an extra geriatric certification through my professional association as well. And over the years, I always ended up seeing the people that hadn't had success with other practitioners, or hadn't had success just in general, or had complicated chronic situations. And so I was constantly getting thrown out of the box, because for many of these people, they had seen multiple other physical therapists and other kinds of, had other practitioners work with them that hadn't been successful. And so, I learned very early on how to have a whole, really how to look at a whole system and a whole body. And that's something that medicine, I think, still really struggles
very much so,
with.
Especially traditional medicine.
Absolutely. And so understanding that how knee pain relates to your, like the junction between your middle and lower back, or how even like neck pain and your low back function are related, and things like that, was the foundation not only of my physical therapy education at the University of Southern California, but also a lot of mentoring that I had along the way. And in the evolution of that, what I really fell in love with as a treatment paradigm was really treating the vagus nerve as a pinch nerve. And there's so much amazing research on the vagus nerve now, and I've been talking about this for a long time, and it's been like screaming into the void. But now people are really ready to hear it, which is super exciting.
Good. So are you familiar with Blair technique of chiropractic?
No.
So Blair is an upper cervical technique, and it's all about getting the pressure off of C1, C2.
Yeah.
And the theory is that the majority of us, I don't know the statistical numbers because I'm certainly not a chiropractor, but the theory is that the majority of us walk around with a kink of our brainstem coming out of C1, C2 at the atlas and axis. And so Blair is a very precise upper cervical technique that really gets the pressure off of those nerve bundles. And we're fortunate that we've got a couple of Blair chiropractors here in town. And so I refer the bulk of my patients to them, because
nice, yeah,
I want that precise decompression. So
it really makes such a huge difference. And I would say that if, what I find, or just in the way my process works, is that when I address the jugular foramen, which is where the vagus nerve exits the base of the skull, that very often the C1, C2 dysfunction just melts away.
Yeah.
From that. But absolutely, they're like, we know that trauma always affects the voice and the breath, and your vocal cords and your diaphragm are horizontal muscles. And so these horizontal planes in the body, like the base of the skull, vocal cords, thoracic inlet, I'd say even at the level of the heart, where the pulmonary artery and vein go horizontally, diaphragm and pelvic floor, are major compression points for the vagus nerve.
Yeah, which makes sense. So
Yep.
does your theory kind of follow the meridians, right? That kind of describe this Blair technique with patients often, and they say, how's my knee pain going to be affected by my upper cervical? And I'm like, well, because everything's connected. Like, you just don't
Well,
understand that.
yeah, I don't usually describe it in meridians just because I don't have a fluency with that, but your vagus nerve uses acetylcholine as a neurotransmitter, and that's also what your muscles do. So you get these really, I think that's why you get really beautiful neuromuscular changes with vagus nerve decompression.
So how are you decompressing the vagus nerve?
So I do, I have manual, for people that come to me in person, I have manual techniques.
Okay.
I have online, or you can go to my website. I have a free vagus nerve decompression course that I taught last year for the Australian Breast Cancer Rehabilitation and Wellness Summit. And it takes you through a self-assessment and the exercises and a reassessment. So people are welcome to go check that out. I also work with people online, and I have, some of that's guiding them through the practical things, and some of it's, I have a set of energetic skills as well to help them kind of feel into where their bodies are tense and guide them
and
through
I saw that on your page. Tell me a little bit more about that. Tell me a little bit about that spiritual and energetic side.
Yeah. So one of the things that I have loved to do for really my whole career, and especially with these complicated chronic pain patients, because as a physical therapist, you spend a lot of time with your patients, much more than a lot of other practitioners do. And, and you see them over multiple visits. And I've been around long enough where we had a lot, when we had more time than more, when it was not unusual to maybe have 10 or sometimes even 20 visits with somebody. And I really love tapping in just what makes people tick and what the root of their stress, or the pattern that I saw consistently is that people that had really messy physical dysfunction also had really messy personal lives very often. And so there was this, I identified very early that there seemed to be this relationship between what was going on in their lives and what was happening in their bodies. And medically, we know that stress is the root of all disease, but we don't really define what stress is very precisely. Or we do medically maybe in terms of, we can measure the heart rate variability and get a really good idea of what your vagus, your stress level is in terms of your vagus nerve function, but to really understand the story of how that's playing out in your life. And in my own evolution, I had probably about 7 years ago, my life was really falling apart. My physical body was really was falling apart. I had shoulder pain and foot pain, and my blood pressure was really high to the point that my feet were swelling. And I was like, I take care of myself. I exercise, was eating really well. I had lots of structure, and I couldn't figure out why I was falling apart physically. I was having a lot of, also having a lot of turmoil within my family. And I had a professional lawsuit brought against me as well. And so my professional life was really starting to crumble. And I had always thought that I was really supposed to be this highly credentialed physical therapist. And I was really forced in all of that falling apart to look at the spiritual underpinnings of my own dysfunction more intensely than I ever had previously. And as a result of that, I had branded myself as a stress management expert, and I was so stressed, and my practice was just not fit. It just didn't feel like it fit. It was like shoving a square peg in a round hole. And, like I was kind of hiding who I really was in all of this clinical expertise that I have, and not showing up authentically for my patients, and ultimately not really even for myself. And one of the things that I learned in my own self-discovery process was that mythology, among many things, was a mode of communicating scientific information. So, for example, in the myth of Isis and Osiris are all the numbers of the Earth's, or are numbers that are associated with the Earth's precessional cycle. And so it was a way that they communicated the cosmology. And the first place my brain went with that was to say, well, the Earth is at a 23.5 degree tilt. So what's 23.5 degrees from the midline? Because as a PT, I deal with angles
Right.
all
Yeah.
the time. And so where your vagus nerve exits the base of your skull is 23.5 degrees from where the center of where your spinal cord exits the base of your skull. And normal C1, C2 rotation is 47 degrees to each side. And your anterior cruciate ligament average is at a 47 degree angle as well. And so there were these, and I mean, there's more, like I'm collecting angles,
Right.
you know, in this, you know, there's more of them, but, you know, I mean, you know, as a primary care person, that headaches, dizziness, and ACL ruptures are probably a pretty significant chunk of your clientele.
Well, and I'll tell you, I'm a little bit different in that I'm not just primary care. So I spent probably the first 15 years of my career in orthopedics and evolved into primary care because I do things very non-traditional. I tend to be very holistic and very integrative. And so while I was treating orthopedic issues more naturally and holistically, I would also help them with diabetes and cholesterol and whatever else they had going on. And it just evolved to what it is now, which is this happy blend of this very non-traditional primary care with a very heavy ortho side too. So,
nice. So that was the first thing that was really exciting to me, to see these relationships in these angles. And then the second place that went, I had part of my own, like in my own self-discovery process, I had delved into astrology. And around the time that I had been reading all this, I did an online it was right around the holidays, you know, maybe 5 years ago or so. And I did an online stress management presentation, and I ended up talking a lot about the ventricles of the brain that make cerebral spinal fluid. And I've done craniosacral work for a long time. I took my initial training at Michigan State University's College of Osteopathic Medicine, so I kind of come out of that osteopathic background with it. And I have a favorite picture of the ventricles of the brain from one of my anatomy books that I have had for at least 20 years. I purchased it a couple years after I graduated from PT school. And I thought, oh, I'll just put that on social media, you know, since I talked about the ventricles of the brain, but I hadn't looked at it super recently at that time. And when I opened up the book, the image is a compilation of MRI images to give you a 3D picture of what the ventricles of the brain look like. And they look just like the ram's horns for Aries. And in astrology, Aries rules the head. And so that immediately perked up my senses. And I was like, oh, if mythology is code for anatomy, you know, where's the rest of it? And so the way your hyoid bone sits on top of your larynx looks just like the symbol for Taurus. And in astrology, Taurus rules the throat. And your aortic arch is the same shape as the symbol for Leo, and Leo rules the heart. And it works this way the whole way through the body. So this has evolved into a process I call story prescription. And I use that in two ways. One, to use the story to help dig into the spiritual underpinnings of the physical dysfunction. And this works not only through the Greco-Roman mythology traditions, it works through Egyptian mythology, it works in Hindu mythology, it works in like biblical stories. The Temple of the Ark of the Covenant tells the story of our cranial anatomy. And so there's so many really amazing traditions that describe our anatomy in really remarkable detail and give us clues as to where I think our underlying stress is. And I think this might have been something that our ancestors understood better than we really do. You know, or as we got into more an allopathic tradition, that this is part of what was lost in it. And certainly as humans, we connect much more with story than we do with process. And the difference between acute, subacute pain and chronic pain is that chronic pain gets locked into your limbic system, which is where your emotions are. And you need an emotional key to unlock it from there. All of the leading pain science experts will tell you that they get really excited when somebody cries or gets angry because they know they're going to get better. It's the people with a flat affect that they worry about. And the other way that I use the story prescription is as a form of energy medicine. So like we literally have an energetic set of ram's horns in our heads and a bull in our throat and a lion in our hearts. And there's I think it's quite literally the way the cosmos is coded into us. And like we all have internal cosmology, and the
Oh
rule that
God,
we
this
all
one's gonna get.
follow is as above, so below.
Mm-hmm.
And we all have a physical expression of our internal narrative and an internal expression of our physical narrative. And it's the rub between those.
Do you find then that you end up working with your clients more in the spiritual and emotional to release the physical, or do you find it's a pretty even balance of both?
It's a pretty, I would say I can go either direction. It's an pretty even balance of both. And some of it depends on the client. Like at this point, I have a reputation, and so people sort of know what they're coming for, and I don't always have to warm them up with the physical structural stuff. And as physical beings, our bodies speak in the physical language, and sometimes it really is just as simple as like this joint needs to be decompressed, or this,
right.
Like here's like you need a structural intervention to start. But either way, what I've really come to understand is that when you treat the physical body, the story doesn't always change. But when you treat the story, the physical body always changes.
Yeah.
And acute medicine does this really well. You break your leg, they set your leg, or you have a heart attack, they restart your heart. But the chronic medicine doesn't really doesn't treat the story so much, or there's not that one-to-one relationship that there is in acute medicine with it.
Well, that's so true. I saw an interesting video recently with a physician out in California who does some alternative and integrative work, and
Was it one guy, one jar?
Who he was seeing a patient who'd had just chronic pain. Her life, quality of life had really deteriorated, and nobody could figure out where her pain was coming from. Mm-hmm. And so she kind of went to him as a last ditch effort, and kind of doing some muscle testing and different system testing. He figured out that all of her symptoms started after she'd had a transverse abdominal incision. So he quite simply injected lidocaine into that abdominal incision and basically numbed it up and watched as all of her body pain melted away. And it was just that meridian had gotten blocked by that transverse incision, when everything's meant to flow up and down. And so it was really cool to see, something as simple as just some lidocaine getting injected in gave her just, her life back, really. I mean,
absolutely. Yeah. Medicine does. I mean, there's so much, there's so many amazing things. And we have with those horizontal compression points that I described earlier, they limit everything that goes through vertically, the nerves and the arteries and veins.
So we were talking about the horizontal channel.
Oh, we're talking about, yes, horizontal. So you have these, we have these, so earlier I mentioned that we have, that the vagus nerve gets compressed where we have horizontal structures.
Right.
And nobody gets injured or feels terrible, gets traumatized and walks with really great free arm swing. We all freeze up or we lock up rotation. Mm-hmm. And so, but we live in this very rotational universe, because the math of the cosmos, like Fibonacci sequence, is all very rotational. And whereas rotation is the first thing that we give up, and you can track this story very structurally, especially with back pain patients, that they give up rotation and then they get excessive side to side motion, they get excessive coronal plane motion with their hips, and then when they end up beating up their back too much that way, then they end up taking up the sagittal plane and they end up forward. And so we can tell that this we see this progression all the time. And but rotation, I don't think we give it back in a very skilled way as a whole, for the medical system as a whole. And for example, in all humans, the right side of your diaphragm has more muscle mass than the left. So theoretically, the right side will always win. And so when and so people get locked down, like overwhelmingly people get locked down kind of like this.
Right.
You know, and posturally, we see that low right shoulder a lot.
Yeah.
You know, and certainly, you know, we live in a right-handed world, and there's, you know, there are some very practical reasons probably for that. But when we think about alignment, you know, and kind of pull, you know, if we think of ourselves as fractals of the cosmos, so that we have this maybe kind of internal cosmology, how we mirror the world around us. When we're locked up like this, the earth below us and the solar system above us are all spinning the opposite way. And so I think there's this bigger alignment at play that moves through our bodies. And we know that that when we know that our vagus nerves synchronize with the electromagnetic field of the earth, and certainly the vagus nerves are going to create the electromagnetic field of our hearts.
Mm-hmm.
And the Heart Math Institute has done some research around this. But they also know now that when solar and space weather disrupts the electromagnetic field of the earth, it's measurable in our vagus nerves, and the extent to which it disrupts us depends upon the strength of our interpersonal connections. And so we know that we're part of this much bigger picture.
Right.
And that to me is such a fun playground, and to really think about, like, where is this bigger story that's happening, and whether that's happening through, you know, kind of on the physical, you know, through physics, or through, you know, biomechanics or cosmology or whatever, or through story, you know, like the stories that, you know, that go with the stars and the way that the stars and planets are moving. I think that it works both ways. And I think and it's so helpful. Like in the physical therapy research, we know that people get faster pain reduction and greater strength gains when you give them an external cue. So like, instead of, like, if you're going to, like if I was going to give like sit to stand as an exercise, like if I was going to come out of this chair, if I said something like, touch the shelf above the desk, you know, or come up to the shelf above the desk, versus lift your hips up. When you give that external cue, people get faster pain reduction and greater strength gains than when you give them an internal cue. And I think it's a little bit like that with story prescription. When you give them a story that that shows them where the stress they're living in, you know, the way stress has been expressing through their physical bodies, that they start to get unstuck from their own story. They see it outside of themselves.
Yeah.
As well. And I think it does something to kind of interrupt those circuits.
So how long does it typically take you? You know, we think about, you know, all the years that I've written PT, you know, as a nurse practitioner, you know, I'd write 3 times a week for 4 weeks, and then I would renew it, you know, 2 or 3 times, depending on what I was sending them for. So doing what you do, how many sessions does it normally take for you to, you know, start to finish with a client to realize a big gain?
I see a lot of people, historically, what I used to tell people is that you should be dramatically better in 4 visits, or this is not what you need. And then people started getting better faster.
Wow, okay.
I like, a lot of times it really, like, it can be a 1 visit thing. I usually suggest like a 3 visit package, just to like, you know, like working with people individually. But I've been doing, as I've been restructuring and trying to move into more teaching kind of roles, I am looking to, I've started doing groups, because in the same way that I found that I can unravel, like I can evaluate a body and figure out where the body's most restricted and treat that and get the whole body to start to shift, that I can do that for a group too. And I'm running online groups now. And so for people that can't, you know, especially right now, that can't go to physical therapy because, you know, with the COVID-19 stuff, it's a really great, like I'm good at the orthopedic thing, you know, like the joint pain piece with it, but I get people for a lot of different reasons. So I have I have a group schedule, and if you're, and if you go to my website for them, there's a discount code that you can get half off. I made it because it's a new format. I know it's really different, so I made it really accessible for 2020 with a discount code. It's $27.50 to to come to a class, and I limit them to 7 people, so it's a small group.
Good.
And so there's so that's really where I'm trying to drive people to do the group stuff. And then I'll still have my some of individual one-on-one stuff, but the group stuff is really magical. And it's so, because you hear your story then in what's happening with other people as well. And I think our HIPAA laws have really not served us at all. I think they actually keep us from getting better, because to really heal, I think you have to be witnessed.
Yeah. Well, and I think HIPAA's evolved over the years. You were around as a practitioner when it came out, and I remember, I joke with my students. I teach a lot, and I say, in the pre-HIPAA days, we could do X, Y, and Z. And now HIPAA says you can't do that anymore. You got to follow this box. And we got away from individualized care because we were too afraid to step on HIPAA's toes or violate anything. And so I think it really depersonalized the care that our patients get, just to save face, really.
Oh, absolutely. Well, and I think that the push for evidence-based care, where all the evidence-based, professions had the evidence-based practices come out, and while there's a lot of merit to that, one of the things that I've seen it do is to suck out all of the creative and critical thinking.
Yeah.
And because if somebody shows up in front of you and there's not and they don't fall into a clean diagnostic box, like practitioners start to blow circuits. They really, it becomes overwhelming. And, and certainly the way medical coding goes, like if you have neck pain, shoulder pain, and knee pain, like they'll only see you for 2 of those, only listen to 2 of those things. Like they won't even listen to your whole situation when you go in for a visit. And I think that that's a huge problem in seeing how all of this works. When I tell my own story, I tell it through the lens of the myth of Isis and Osiris. And in that is an Egyptian myth. And Osiris was the king of Egypt, and his brother Set was jealous and angry and really wanted to be king. And so he tricked Osiris into laying down in a bejeweled coffin and had his 72 soldiers shut the lid, nail it, carry him to the Nile River, and send him down to his death. Well, Osiris's wife Isis found out about it, found the coffin in his body, took him to a cave, and brought him back to life. And when Set found out that Isis brought him back to life, he was furious. And so he found Osiris again and chopped him into pieces.
Oh my gosh.
And scattered his pieces all across Egypt. And so Isis again found all of his pieces, brought him back to the cave, put him back together. She found everything except for his phallus, and for that she made a new one. She brought him back to life long enough to conceive their divine child Horus, and then Osiris went on to be king of the underworld, which for the Egyptians was where all life came from and where all treasures were found. And so when we use dismemberment metaphors in our language all the time. We say we can't get it together, we're falling apart, our hearts get broken, our lives get shattered. We'd give our left arm for something that we really want. And medicine, so we use this personally, so we all have what I call our own Osiris wounds where we've fallen apart. But medicine as a profession has a terrible Osiris wound where it's just chopped up into pieces, and nobody's really looking at the whole, and the way they're looking at the whole is not even whole. And so we really need to start bringing medicine back together in a new way.
Yeah, it's funny you say that. When I shared that my practice is so different, and I have a direct primary care practice, which means my members just pay a monthly fee and they see me whenever they need to, and they have 24/7 access. But one of the first things that all of my new members do is we do a big new member intake. And I tell them, budget time wise, 90 minutes for that visit. Then I'm going to bring you back and we're going to do your physical, and it's going to be a head to toe physical with labs and an EKG. That's going to take us another 90 minutes to 2 hours. And then after that, I'm going to see you whenever you need to see me. And we're going to do those for a minimum of 30 minutes, 30-minute appointments. But if you need an hour or two, then you need an hour or two. It's what it is. And so they're always surprised when I say, all right, tell me from head to toe, what's going on? What are all your problems? You know, what do we need to address? And, you know, I'm always met with, we can do all that. I'm like, yeah, I don't answer to the
So
insurances.
fantastic.
You know, like,
Yeah.
and I treat, because my practice has evolved the way that it has, I'd say probably 75% of my patient population is autoimmune patients. And, you know, they're used to the box treatment. And I
Oh,
tell them all at the
yeah.
beginning, take your idea of the box, throw it away. I live about 5 miles from the box. So I don't even see your box when I look at you. I see you from head to toe. I don't see your diagnoses. I don't see your limitations. I just see you. And then we work through our goals. You know, let's put your issues in priority and let's work through them from top to bottom so that we can get your quality of life back. So, you know, you're kind of doing a similar thing. You know, you're systematically working through the body to, you know, fix their
Absolutely.
imbalances and their dysfunctions to give them their life back.
Absolutely. Yeah. And we all, you know, we all want to be seen and heard. And, you know, I mean, you know, especially with like that autoimmune clientele and those chronic, you know, that end of, you know, that spectrum of disorders, that because so many of them have, you know, got referred to the psychiatrist before they got any kind of actual medical care.
Yep.
That, you know, not the psychiatry is not actual medication, but, you know, before, like, they, you know, got
Yeah.
referred to the psychiatrist for something that really had a physical
Exactly. Right.
issue that needed to be addressed. And they the weight that comes off of them when they feel heard is just enormous. When you say, you know, like for me, like on a very, you know, on a more conventional level, when one of the things that I see all the time, especially in back pain patients that haven't gotten better, and I will say especially in people that did not respond to an epidural injection, is that their hip flexors are so tight, they're essentially stuck in a fetal position, but they're walking upright. And so the amount of compensation they have to do to achieve that is enormous. And their hip flexors, for me, hip flexors are a secondary response to diaphragm dysfunction. And when you fix the respiratory diaphragm and get it back in the right place, the hip flexor dysfunction just melts away. And you know, my favorite response, it's always, you know, kind of cute when they get up off the table and they're confused about where their pain went, and then they're angry because they're angry that it was that easy, you know, and like, why didn't this happen sooner? You know, or they're overwhelmed and they're crying. I've said for years and years that I'm really good at making people cry. So
there is a big emotional release though that comes with not only being heard, but appreciating, or validation really is what it is, you know.
Absolutely.
That and my patients say it to me all the time, like, not only do you listen, but you genuinely care that I don't have the quality of life that I want. And I'm like, nobody should have to suffer. Like, we're not going to stop until I have the answers to fix you. That's as simple as it's going to be.
Yeah, no, absolutely. And I work with a lot of functional medicine doctors and integrative medicine practitioners to, you know, because I don't order lab tests and things like that, you know, to work with it from the nutritional standpoint and the physiological, you know, to get some of those, or to see how some of those measures are evolving as we're doing this. But you know, our bodies tell our stories, and there's, you know, and one of the things that I've really learned, like, I know, like, I will tell you that in terms of the vagus nerve compression, all the biomechanical tests that I use in my evaluation process, that I know exactly how to spot suicide ideation now. It shows up in a very specific pattern, and and I just know to ask for it. And I've had the incredible joy of helping to resolve that in some people, and
that's amazing.
Which is just absolutely, it's so, I mean, it blows me away. Like, and I've even had I've had a couple of clients with acute onset of hallucinations, which is a really, like, strange thing to show up at my, you know, at a PT office. but that they're like decompressing their vagus nerve did wonders. And grief, and even like deep grief, when people go into like are really more in a state of freeze, autonomic freeze mode, you know, from the loss of somebody close to them, they're you know, their system literally freezes up, you know, like they literally can't move through the grief because their system can't move.
Yeah, they're locked into place.
They're totally locked, and and there's just some really nice, simple ways to be able to address that both in person and remotely.
So tell us, do people, you know, beyond you, is there a group of practitioners that specialize in, you know, vagus nerve decompression? How does somebody not in New Orleans find somebody like you?
Mm-hmm. I did some training with a group whose their branded technique is called integrative manual therapy. And if you find somebody that's trained in, I believe they're all coming out of the Connecticut School for Integrative Manual Therapy now, or that's the sort of the head training place now. It's had a few name evolutions. I haven't taken courses from them in many years, but their work is very good and they understand that. You know, certainly if you have, in New Orleans, we don't really have very many osteopathic doctors and not ones doing manual medicine for sure. But if you have that in your area, that's a fantastic place to start as well. And the Postural Restoration Institute also does very good structural work, and you can go to their website and find a practitioner. But you know, I'm available. I transcend all time and space. I'm available for anyone that's, you know, but I understand that some things I appreciate, because I have clients that fly in from out of town to see me, and I really do appreciate like sort of what works really well online and what works really well in person, and how, you know, like they're a little bit different, and you can do some of the same things, but it's sometimes, you know, sometimes it's nice to be able to physically have somebody put their hands on you too in a skilled way.
Well, how can you decompress the nerve if you're not manually doing it?
Well, you can do it. I mean, I can teach people how to do it themselves. I've modified a lot of my techniques to teach as home exercises, basically.
Okay.
So that people can do it themselves. And energetically, that's just part of the remote energy work, and being able to, you know, as I've built that skill set, that not only can I tap into sort of that story level of your body, but if I need to release your C1 and C2 or release the base of your skull, that I'm able to do that as well. And so I know that's a very out of the box concept for most people, but it's
as a Reiki master, I totally
so
get it.
Fun.
Yeah, I totally get it.
Gives me so much joy. So yes, it doesn't really matter. And honestly, at the end of the day, I think when you treat the story, the vagus nerve decompresses itself almost always. Like there's this real unraveling when you hear people and you get into the story level of their body and that story that's expressing through them.
Do you work with all ages, or do you have, you know, an age range that you prefer?
I do mostly adults. I'll get teenagers. I have done babies. Vagus nerve compression is magical for babies, especially with colic and failure to thrive, projectile vomiting.
Yeah.
Like it can be just absolutely magical for them. I don't get that, you know, unless one of my clients has a baby, I don't get that many babies. But I do see a lot of the other piece of my work that's really opening up, other than for the you know, people with health issues, is really using this to enhance performance for entertainers and athletes and artists, to be able to, you know, open up creativity and embody a character.
Interesting.
And and to be able to keep their voices healthy, because by the time somebody gets vocal nodules, their vagus nerve is compressed at multiple points, and they don't have any compensation left. So getting it for vocalists to be able to use their full range and enhance their performance as well. has been an exciting development for
That's
me.
really cool. Now, I did see on your website that it said you were working on a practitioner program that there would be CEUs.
Yes, yes. I'm still putting, I have lots of irons in the fire right now. And so but yes, I'm working on putting together some professional training for CEUs. I've got a program with like a bigger program with an artist brewing, a visual artist brewing at the moment. And then the next thing to go after that, I have the structure for the program with theater artists and like physical performers.
That's
Is
cool.
gonna go after that. So lots of super exciting, different, play. Like, you never know where you're gonna end up. If you had asked me 10 years ago if I was gonna be doing this, I would have said absolutely no way.
Yeah. So how much of what you do now is still kind of hands-on traditional PT versus this other component? How much is your time split between the two?
I don't I don't separate them
Okay.
so much. I use the traditional PT stuff is absolutely my evaluation and my outcome measure part of it. And but like over time, what I've just, and I used to go in and do the structural release and then go into the go into the energy or do the electromagnetic, or I call that alignment with the earth mechanics, like an electromagnetic alignment. But I find I tend to go in through the story first now, because 90% of the time the physical dysfunction disappears.
Interesting.
With that, it's really like I wouldn't have always, and I was just so as a medical, I was just in the habit of going through the physical part first, because that's just what I was most familiar with.
Yeah.
And so, that was just my comfort thing. But when I started playing with doing it, going in from the other side, it's really interesting how that the shifts are actually, I think, even more profound, and then you have less of the physical dysfunction.
Yeah.
After that.
That's
so
cool.
It's, but I do, sometimes, there is sometimes I do just go like, we're just going to do it physically and see and then I'll see what's left after that, especially if something's being a little bit stubborn and letting go.
Mm-hmm.
But I have the great privilege of being able to make miracles of huge transformations all the time.
Yeah.
And it's just so incredibly exciting. And I think we make healing a lot harder than it really needs to be.
Yeah. Well, and I think so many people don't understand or fully appreciate that true holistic care, that it is mind, body, spirit, energy, all as one cohesive unit. I think in what I call the SAM model, the Standard American Medical Model, it's very compartmentalized. You come in with knee pain, for example, and I can only look through my little scope directly at your knee, and I can't see the bigger picture. So when patients find people like you, like me, that can look at the bigger picture, I think in a way it can be overwhelming for them, because they're not used to that. They're used to that little fine periscope of vision. So what do you say to those people? How do you convince them that what you're doing is legit? Do you have to convince them, or they just go, oh, I love it?
Most of the time, I will say, so talking about the vagus nerve is an easy discussion for that, and saying that, look, we're going to decompress your vagus nerve because it uses the same neurotransmitter as your muscles, and this is going to change your muscle tone in your whole system, and then we're going to see what's left at the joint. Now, certainly if somebody, in the midst of my, for all the vagus nerve work that I do, if somebody has shoulder pathology or knee pathology or foot pathology or whatever going on, there are often other levels of treatment intervention that then need to happen.
Sure.
Whether that's kind of on the spectrum of myofascial release to the energy piece as well. But most of the time, they're so blown away, you know, like they experience enough of a degree of relief with the initial vagus nerve decompression process that then they buy into it
Yeah. Then they're sold.
very easily. Yeah. Then they're sold. And so it's not to, you know, like I've had those people in the past, but like now I've been doing this long enough that I don't tend to attract that kind of person, but it does, you know, and I'm really happy to go toe to toe with the medical, you know, with I'm happy to have all of those discussions. Like, you know, I don't back down from it at all. But when we can treat if you have a knee problem, we can treat your knee all you want. But if you're super tight, if you're tighter at the base of your skull, your knee is only going to get so much better.
Yeah.
It doesn't matter. So if you really want all of your healing potential, we're going to do all of it.
Yeah. Yeah. And I think that's, you know, I think the greater society has been trained to think in that compartmentalized mentality, that there's definitely some retraining that has to happen to make them aware that this and this affects your feet and your knees and your hips and your gut and you know, and every other piece of you. So
yeah, no, it's treating in you know, life doesn't happen in a petri dish, and for all the really great evidence-based care, you know, research that's out there, you know, there's also then real life
yeah, for sure,
you know, that you have to weave into that.
Exactly. And I think, you know, especially for chronic pain patients, and I know for my autoimmune patients, they become their diagnoses. You know, I am fibromyalgia, I am knee arthritis, I am, you know, whatever that diagnosis is. And they lose themselves in the process as they go from, you know, specialist to specialist to specialist to provider to provider to provider. And they're just given another diagnosis and another diagnosis and another diagnosis. And, you know, nobody stopped to say, but how are you as a person, as a spiritual person, as an entity? How are you functioning with all of this, you know?
Absolutely, yeah.
And it sounds like that's what you're addressing.
Absolutely. I love that so much. Like, what, you know, tell me, I love addressing, bringing people kind of back into that wholeness, you know, when their spirits have been broken like that, or they've had their own Osiris wounds. One of the best evolutions in more recent years, that's becoming more standard in medicine, is the adverse childhood experience scale. Like, you know, being able to, because it's so often that, you know, it's like, well, what happened to you? And I very often will ask people what happened to them when they were, I find 7 is a big one. That there, you know, there's certain, or like that 6, 7 age tends to be a big one, but depending on where the issue is. And I relate that a little bit to chakras. If you think like your first year is about your first year of life is about your first chakra, and your second year of life is about your second chakra, and, you know, it works all that way up. And I find that people that have things that happen to them between 7th going back to 1st seem to be the noisy, the more problematic, more visible things. And so that's just a very casual observation, but
yeah, but that's interesting.
But I think it's always really interesting to think, you know, or people with stomach problems, like what happened, you know, between when they were like, you know, around age 2 to 3, you know, that kind of thing, you know, or like, and then, you know, a little bit later, like 8, 9, 10, you know, like you can kind of,
the cycle of it.
Yeah, the cycle of it is really interesting. And we all, you know, I could tell you about the 7-year patterns in my own life of how things went through. And so I think that those cyclical patterns are very interesting to me, and the astrology has been helpful to sort of think about how to structure those and think about those a little bit as well. Whether or not I use, you know, I'll often look at the astrology if they're open to it, but it's just interesting to think about, you know, to think of it in cycles and how we work in cycles. And when we're, you know, you get people that are repeating, it's like, oh, you know, I hurt my knee when I was this age, and then I hurt it again when I was this age, and then I'm, you know, now here I am with the knee thing again. It's like, okay, well, let's think about what this cycle is, and what the universe is maybe trying to tell you.
And the interesting thing is that our tissue, our whole body tissue, recycles on an approximate 7-year pattern. And so, you know, when I I do some regenerative treatments, and patients always say, well, how long is this going to last? It's going to last as long as this tissue cycle does. And when the new tissue cycle comes through, what we did today will be gone. And that you may be a 5-year recycler, or you may be the 7-year recycler. I don't ever know. So you're saying kind of that same pattern,
Yeah, no, absolutely. Yeah. And I just tie it in more to the thinking about like what was going on in your life at different points, and what is that underlying stress, or what are you missing, or what has been your kind of your wounding pattern in your life, and how is this an expression of that, and how can we work to shift that? And sometimes it's really simple in terms of rearranging, like a lot of people, because if we're driving, we get out of our cars to the left, and if you get out of your desk to the left and you get out of your dining table to the left, you're just going to develop a muscle imbalance, and you need to start doing something to the right.
Interesting.
And that's one way that like our external worlds will manifest in our physical bodies. But then sometimes it is, you've got to kind of do that on the inside a little bit and start to shift how you think or see things. But giving your vagus nerve some space makes that really opens up the portal for that. Because, and I'll say, like in the research, I know of research where when they do put electrical stimulation on the vagus nerve, they find it remaps your cortex. And for all the really amazing brain research, I think we have to start going into the body, because the brain is just, we're getting the information in the body first. So much is going from the body to the brain, and we're not measuring that input.
Yeah. Interesting. Well, this has been really informative. Is there any last parting things that you want our viewers to know about you or the work that you do?
I teach for free every Tuesday in my archetypal alignment circle. You have to sign up for it to get on the list. And the recordings are available afterwards. So if you want to hear me talk for an hour every Tuesday about a variety of topics, usually there's a focus about how story lives in the body. I love to have people there and love to have all the questions. Please check out my free vagus nerve decompression course. I love empowering people to help themselves. So that's on YouTube, and you can get that via my website as well. And reach out to me with questions. My social media on Instagram, Twitter, and Facebook is Embody Your Star. And so
and
the
what's
Facebook
your
page,
website?
And my website is my name, melanieweller.com.
Okay, perfect. So thank you so much for your time. And
thank you, Penny. Dr. Penny.
It was great. And we'll get this shared on all of our different media outlets.
Awesome. Thank you so much.
Thank you. Have a great night.